All right, everyone. Welcome back to our live show here at Partners in Pediatrics and Family Health. If we haven't met, I'm Dr. Obidi, pediatrician and CEO here at Partners in Pediatrics and Family Health. We are a family practice. We take care of both adults and kids, and I'm excited for you to join us today for our weekly live show. We actually had two today, so if you hadn't checked out the earlier one that we had earlier on today, go check it out. But we are going to have a fantastic time with a good friend, Dr. Taiwo Durawadi, who is a board-certified obstetrician and gynecologist who is practices out in the Chicago area. I'll let her do justice to introduce herself, but we're going to have a wonderful conversation about a topic that everyone who has a daughter in the house or knows a young lady or dreamt they may have known one at one point should hear about, because we're going to be talking about periods in young ones, when to have that conversation and all the wonderful things. So let's welcome Dr. Durawadi. Thank you so much for joining us. That is such a treat for you to be here with us today.
Thank you so much, Dr. Obidi. I appreciate the invitation and the opportunity. Thank you so much.
The pleasure is mine. But why don't you go ahead and tell us a little bit more about yourself, what you practice, what you do, and we'll take it from there.
Absolutely. As you said, I'm Dr. Taiwo Durawadi. I'm an OBGYN or obstetrician gynecologist. I practice in the Chicago South suburbs, specifically Homewood, Illinois, Homewood, Flossmoor area in the I'm close to Tinley Park, Olin Park, for those who might know the area. The name of my practice is Dadur Gynecology. So I mostly do gynecology, meaning I take care of women. And my mission in life is to transform women's lives. I believe all women should thrive in whatever stage of life they're in, whether they're young, whether they're middle-aged, or whether they're older or elderly, they should be thriving. And so my mission in life is to make sure that they're educated, they're well-informed, they have treatment options such that they can live healthy lives at whatever age of life they're in. And so...
Just compliment life. Awesome.
You know what's so funny is that all my staff are my patients, because by the time I start doing like this, they start hearing the results of my patients. They're like, "Doc, like, can I
transfer?
Symptoms I'm like, girl, let me help you. You don't have to go through that." So I love women's health. I love women's health. It gets me up in the morning. It gives me joy. And I'm grateful that I get the opportunity to be in my own private practice, to do it the way I want to do it, tailor it. If something's not working, change it up, and so it's been a real journey being that entrepreneur. But the gynecology part is thriving. So
that's awesome. Well, that is beautiful. Thank you for just sort of laying that beautiful foundation for us, because indeed, it's a beautiful thing to be able to, I can imagine, walk alongside women at different stages of life and helping them thrive. And so we are going to be focusing on the earlier part of life today, talking about the period, and when to have that conversation with your young daughter. As I was sharing with you before we went live, I'm the pediatrician taking care of kids, and I did not have that conversation with my two daughters. Not because I didn't want to, but because it actually completely, funny enough, took me by surprise. I wasn't thinking about it. For some reason, all of a sudden, they were grown, they were having the periods. I'm like, what?
Like, wait, how old is she?
Who had that conversation with them when it was happening. So I wish I had this live, before they got that age for my own and my own help. But hopefully we can help some other dads and moms not go through that. So why don't you go ahead and share with us, maybe if you don't mind, what that conversation was like with you and
with my own mom. It didn't happen. You know what was so funny is that I would see commercials for Always. Maybe I was like 9 or 10.
Yeah.
Or 8. I don't know. I was really young. I would see commercial for Always. And I had a little issue with bedwetting that lasted a little longer. And so in the commercial, they would pour water on the Always pad. And I would say, Mom, just buy this thing. Just buy. Isn't that what it's for? It's for bedwetting. Just buy it for me. And she just brushed me off and said, you don't know what you're talking about. That's not what it's for. I'm like, they're pouring water on it. That's what it's for. And
That was
so
the perfect time to have the
I
conversation, right?
know that was the perfect time for her to tell me, daughter, there are two places that stuff comes out from there. But that did not happen. She was just really uncomfortable with the conversation.
Mm.
And so what happened was I went to a friend of mine's, we went to a friend's house and I saw the always there. And I said, do you have bedwetting too? Is that why you have the pads? And then her sister called me and said no. It was her older sister that called me. I
Oh,
said
boy.
no. There are
It's
two
so
holes
funny.
there. You pee from one and blood comes out of the other. I said, why would you have blood coming out of the other? She said, that's when you're a woman. So
Oh,
I actually
geez.
went back and asked my dad. I said, so dad, what is this? Is what she said, is it true? Because my dad was more comfortable with us. We
Uh-huh.
talked with him more, and he confirmed that it was true.
Oh,
Um,
boy.
that
This is too
that, and so
funny.
the always pad was not for bedwetting, and so it's for the other stuff. And so my dad
Okay.
was the one who had the conversation.
Okay, Dr. Taiwo, that's why we're doing this, okay? Because we want to spare some other young girls and young ladies, in the making from having to think that, a pad is for bedwetting. So please, please, please help our parents, sort of talk us through what that
Mhm.
conversation should look like.
Mm.
I mean, there's so much to talk about, so I don't know if I want to necessarily start with what's a period, but maybe we can
Mm,
do a
mm,
quick one, two
mm,
sentence, about that, but
mhm,
then go into really what that conversation should look like.
mhm.
Yeah, as we, and at what age to even have that conversation, right?
Right, right, right. And so, a period or a menstrual period is when a girl starts shedding blood from the uterine lining, and that blood comes out vaginally. And it can start as early as age 9.
Mhm.
And so those conversations, by the time they're 7, 8, those kids are sharp.
Yeah.
They kind of know what's going on. And so it can start as early as 9 and it can start as late as 14, 15.
Mhm.
Anything earlier than 7 is abnormal. So if
Mhm.
there's vaginal bleeding in a 7-year-old or an 8-year-old, you start getting a little bit concerned.
Mhm.
And that child should be taken to a pediatrician to evaluate that. And if they have not had a period by age 15, then that teenager needs to get to a pediatrician to evaluate that as well. So a
Mhm.
period is when the brain wakes the ovaries up and says, start functioning. And
Mhm.
then the ovaries start making estrogen. The
Mhm.
estrogen go to the uterus and activate the uterus and cause bleeding. Now,
Mhm.
that process takes about 2 years to become fully mature. So it's
Mhm.
not like, at 9, they're ovulating.
Yeah.
At 9, they're, or 10 or 11 or 12,
Mhm.
they're probably still just, the body's just waking up to the
Mhm.
idea of the ovaries being active,
But the
basically.
bleeding could have started already.
But yeah, exactly.
Mhm.
And so the is just estrogen is now estradiol in particular, a particular form of
Mhm.
estrogen is active in the body, and estradiol, whenever it's in the body, activates the uterus and causes bleeding.
Mhm.
And so some people will get really like alarmed when the periods are sort of taking lasting longer, or the bleeding is lasting longer, maybe it's
Mhm.
lasting 10, 11, 12 days. They're like, well, this
Mhm.
is not a normal period. So for those first couple of years, the first when you get the first bleed,
Yeah.
2 years from then is when it's okay for things to be up and down.
Mm.
And then after that, let's say she starts at 9, by age 11, there should be a regular pattern by that
Okay.
time.
So
And
even before then, she may even skip some days or some months rather,
exactly.
not even have periods.
Exactly. I'll tell
Mm.
you a funny story. When
Mm.
I started mine, I had maybe regular periods for maybe 6 months, and then I didn't have any for 8 months or so. And I used to be very tired, and I'll be sleeping in class, and my
Mhm.
aunt used to scare me that I was pregnant.
Oh no.
I was like, is that how it happens? Like, it just happens because you're sleeping and your period doesn't come? I had really, there were the people around me, I'm
I
telling
looked at
you.
you, the gynecologist.
The gynecologist. Hello. Hello. Who
That's
knew?
too funny.
Have to get back at them for this.
Yes.
Um, but yeah, it could be very irregular because, like I said, it takes about a couple years for the brain
Mhm.
and the ovaries to get into that pattern. And so I would say the time to start that conversation is maybe around age 8 or 9.
Yeah.
Um, and I not so that we don't alarm them. The
Mm.
kids are not necessarily looking in that area.
Yeah.
By that time, I expect that they're bathing themselves. And so I think we'll just say it in simple terms that at some point you might notice bleeding coming from down there. Just let me know when that happens. Because that means that you're growing into a woman, and there are some things we will need to do to prepare you for that. So not just make it as not as dramatic, not as alarming, not as scary,
Just a matter of fact conversation,
Matter of fact, yeah. Like, at some point you might notice bleeding coming from down there. Just let me know when that happens. Sometimes it might come with a like pain in your abdomen, pain in your lower belly. Just let me know when that happens. That just means that your body's changing, you're growing up, you're becoming a woman, and there are things we need to do to prepare for that. And so I would start that maybe like around age 8 or 9.
Interesting.
Because if they don't hear it from you, they might be hearing it from their friends at school, or from TV, from the internet. And we just want to make sure that we are the ones in charge of the information they're getting.
Yes.
We want to be in front of that. We don't want their minds, their impressionable minds, affected so early or misinformed so early. So we just want to also make them feel comfortable enough to come and talk to us about it when it happens. So that way, when like, you're just growing up, your body's changing, when it happens, let me know. If you're having any belly pain, let me know, things like that.
Because I can imagine maybe some girls may even hide it for a little bit when that starts to happen.
Yeah, because they're scared. Maybe they'll go ask their friends, have you seen this happen to you? And, we don't trust their peers to guide them.
Absolutely.
And so I would make it such that they're comfortable enough to bring it up to you when it happens. So don't brush them off when they ask questions about their private area. You want to be informed about anything that's concerning them about that area, so that when things begin to change, when they start, the first thing actually that happens is hair growth. They start noticing hair in the area. They don't want to be freaked out by that. That's normal. They want to be, you want them to come to you, and then after the hair is the breast buds. So the breasts start to come in. And so those are the times, even before the period starts, that you start noticing hair in her pubic area. You start noticing that her breast buds are coming in. Start the conversation. Yeah, your body's changing. You're becoming a woman. After this, you might start having bleeding coming out from down below. Just let me know when that happens. And even before it happens, once you start seeing the hair, once you start seeing the breast buds, it's time to get the kits that she can carry with her, because you may not be, maybe at school. I was at school no, I was at home. And I remember running to my mom and saying, "Is this it? Is this it?" I'm telling you, she was the wrong person. She was the wrong person to ask these questions. She still didn't tell me if it was it. She was shy. She was uncomfortable. I had to go ask my dad. My dad was the one that said, "Yes, that's it." And then he was the one who pulled out the always. And I was like, finally,
I get to use this. but that's why you're saying, though, to start this conversation early, right? So that it is something you normalize. It's the young lady, girl coming to a lady doesn't feel like this is something to be ashamed of or something to hide. Yes, there's an appropriateness about it, and but that she's comfortable coming to people that she trusts and people that are in her life to talk about what's going on, right?
Absolutely. Normalize it so she's not alarmed when it happens, and she's expecting it. Actually, she's expecting it. And the good news is that there are signs before the period comes. The hair, the breast buds, and the growth spurt, they get taller. You just notice that you're getting taller. So those are the signs that are telling you that in a couple years from the heights, the period is coming. So on average, 2 years after that growth spurt, when they get really tall and are almost kind of like almost your height, is when you can expect that their period will come. So I would say when you start seeing those signs is when to start the conversation of your body's changing. These things are happening. This is what will happen next. The next after that will be something called a menstrual period. It can come with a lot of pain. It can come with feeling unwell, feeling dizzy. Even sometimes it can come with diarrhea, And so having a kit that sort of has panty liners, that has pads, that has Tylenol or ibuprofen in it, that has spare underwear that they carry about, that they have wipes, wet, because sometimes tissue paper can be very uncomfortable,
Comfortable.
yeah. And so just having that kit with them, when you start noticing that they're getting taller, they're getting more hair, the breasts are growing, have them put that kit in their book bag or their purse, wherever they do to go to school, because it could happen at school. And, you want them to be prepared when it happens at school. You don't
Yes,
rush
yes.
into the nurse's station, or I don't know what it is at schools now,
Yeah.
to get a pad. You want them
Yeah.
to have that privacy, so they're not embarrassed. Their clothing is not soiled.
Yes.
It's not something that the entire school has to know that they just started their period.
Yeah. And I can imagine that, that kids could probably have saved a lot of girls and a lot of young ladies a lot of embarrassment in
Oh
school.
yes, absolutely.
So this, even just that right there is gold. It doesn't cost anything to have, a little kid. You could probably, I mean, basically you probably have all that already in
In the
your
house.
home, right? Because there's probably
Yeah.
your mom already at home, or an aunt or someone, other lady in the family that is already, menstruating, that you could just get, a couple out of her pack. And a Ziploc, almost every family has a
Ziploc.
Ziploc bags, you can
Yeah.
just throw all those in there.
Yeah.
So doesn't have to be anything fancy, certainly can make it
Yeah.
fancy if you want to, but it doesn't have to be. This is very accessible for everyone.
Absolutely. Absolutely. Like you said, and if you wanted to make it like inconspicuous, like you didn't want people to look in your bag and see that, there are all these kits that are online, and they're kind of like wrapped. Like you wouldn't know unless you pulled it out and saw that it was, so there are those things, and they kind of contain everything already. So maybe you don't want to put one together because you don't want to forget something. The kit's already made. You can just pick one up either from any grocery store or online. And that way it's always in her bag whenever something starts. It might start like she feels like she needs to go to the bathroom, like she needs to have a bowel movement, and then she'll see the blood, and at that point she'll be like, oh, this is what mom was talking about. Then she has her kit with her. She can clean up and take her Tylenol, take her ibuprofen, and be ready to go about her day. And then it becomes less of a dramatic event like mine, and more of a normal. This is what mom was talking about. This is what I was expecting.
Well, I'm glad. I'm just gonna tell myself right now. It's good to have these conversations, because sometimes also the truth is, even as a pediatrician, it is not something I've gone through personally, right? And so I was even thinking about what you just said now, that having all those packs in a Ziploc bag may not be the best for your daughter. Definitely not a clear Ziploc bag. So thank you for letting us know that even if you had to use a Ziploc bag, be discreet about it.
Be discreet, yes.
Maybe have them in something else,
Yeah,
But
because these teenagers, you never know what they get into.
Yes.
Like someone was looking in my bag for something and
Yeah.
saw this and pulled it out and embarrassed me at school.
Probably makes a big show of it too,
Yes,
right? It's so obnoxious.
I know.
Wonderful.
Yes.
Well, so I know you sort of said to talk about it already, that in the first couple of years things could look different. But maybe could you, because I know what that looks like usually, but a lot of people may not understand how that period starts. Like, is it a gush of blood the very first time, or is it just a few drops? Is it just some staining? Like, what will most women expect, or most young girls expect, for that first period to look like?
That first period could be just a few spots on the first day. But it'll be accompanied by some type of abdominal pain or something that will make them go to the bathroom. So either they feel like they want to poop, or they feel like their belly is just hurting. And so they'll go to the bathroom, and then that's when they'll see the spots on their underwear. It's not usually a gush of blood. And then maybe the next day a little bit more, and then the next day a little bit more. And then it'll stop. So for some women, on average, most women is just very light at the beginning, because the body's still just trying to figure this out. The uterus is seeing estradiol for like the first time, and so it's just activating the uterus a little bit. And so it hasn't had a long time to activate the uterus and fill it up with a lot of blood. It's going to be a few spots at the beginning. And then for some women, for some women, it might continue like that. For some girls, it might just continue like that, continuous bleeding. And that's when, people can get alarmed and go to the doctor, like her period started, but she hasn't stopped bleeding. And now the blood count is low, so those would be things that were abnormal.
Yeah.
But for most people at the beginning, it would be light, and it might last 3 days, 3 to 5 days on average, at the max 7 days.
Okay. I thought it was kind of important to mention that because, some young girl may be thinking, oh my God, horrified at the thought that that first time could be a gush of blood where there's no time to even react,
right.
No. This has started, let me prepare. But usually, like you said, that's usually just a few very light, some drops maybe, or just some staining. So there's time to react and get out that kit and actually, prepare yourself and not necessarily soaking through your clothes that first time.
Exactly. I guess the only time we would worry about that is if they had some type of disorder like hemophilia or something like that. But everyone, I mean, an average person who doesn't have any type of disorder like that would have very light spotting, and something else would alert them, that their period has started. Some type of pain, some type of discomfort is what will make them go check. And then they'll be, because it might feel like you want to go to the bathroom, but it will feel slightly different from it. And so it's kind of what leads them to go check, and they'll see just a little bit of blood on there, and they'll then be like, oh, this is what it is.
Okay. I'm glad you mentioned that. And maybe a good segue to go into what will be abnormal. I know you mentioned a few things about if it starts too early or hasn't started, at a certain age. So if it's starting earlier than 8 years old, or if it's going, past at 15 and you still haven't seen your period. But what other things could be abnormal when the period does start? What will be outside of what a normal period should normally look like?
Yeah. Thank you for that question. That's great. Pain that is not controlled by ibuprofen or Tylenol. So just regular over-the-counter Tylenol should be able to manage their pain. If they're on the floor, missing school, can't go, can't even get up, that's abnormal. And it's not necessarily that something is wrong. There's something called primary dysmenorrhea. Dysmenorrhea means painful periods. And primary means there is no cause. Secondary means that something else is causing it. Most teenagers that have really bad painful cramps, we can't find a reason or a cause for it. So we call it primary dysmenorrhea, meaning no specific cause. And for those girls, high dose ibuprofen, like 800 ibuprofen, or really strong Tylenol, 1,000 of Tylenol, and they would start those things like 3 days before their period comes. So they'll be tracking their periods and taking those pain medicines before they come. But that's something to go see a gynecologist for. I wouldn't just say self-treat that at home. I would say to the gynecologist, make sure they do an exam. There's some girls, it might be an imperforate hymen. It might be that the hymen is not open and the blood is sitting behind the hymen and it's not coming out. So they still need to be examined. If they taking ibuprofen, they're taking Tylenol, but the pain is not going away, they still need to be examined to make sure that the anatomy is normal. The vaginal canal is normal, the uterus is normal, the blood is actually coming out vaginally and not trapped behind the vagina. And so that's important to know, that if your regular over-the-counter meds aren't working, they should see a doctor, because it could be something. Or if the bleeding is heavy, if they're going through maxi pads, that's unusual for someone who's just starting a period. They should just be using the light pads and really not filling them up, because like I said, the uterus is just seeing estradiol for the first time. It's just getting used to shedding the lining. And so if that period is really heavy, then maybe they need to be checked for coagulopathy, like a blood clotting issue, or low platelets, or a thyroid issue. So they need to be evaluated if the bleeding is too heavy or the period is too painful. And some girls may have things like dizziness. They can't stand straight, and it's sort of a reaction to the hormones their bodies aren't used to. And for those girls, they might just need a lot of hydration, like drinking a lot of water, close to electrolytes, closer to their periods. Some may have a lot of diarrhea and are losing electrolytes that way and get fatigued. And so just hydrating them, making sure that they're you're keeping tabs on things. But that's something I would go to the doctor for. Like, it shouldn't be a dramatic thing. It should be something as simple as you had a little bit of pain, you saw the blood, or your period has started, you start using your pads, and every month it happens. For those first 2 years, it could skip months, but
Yeah.
that's okay. But if they're hemorrhaging, then time to see a doctor. If they're too painful and can't go to school, time to see a doctor.
Okay, very good. This is very good, very, very good guidelines. Yeah, this is really good. And again, the reason we thought to talk about this is that it's one of those areas where a lot of girls, like you just mentioned yourself, and even my daughters as a pediatrician, weren't necessarily, we didn't take the time to introduce the topic to them, the subject to them, to get them properly prepared before it actually happens. I know my wife, did some of that, but again, this is something that completely took me by surprise. So, thank you for talking about this. Are there any other pieces of information or areas you think we should cover to round this up as we start to sort of wind down here?
Oh yeah, if after 2 years the periods have not become regular. So let's say she started at 9. Let's say she started, on average, most people start at 12.
Okay.
It's actually a little bit, it's not unusual, it's not abnormal if she starts at 9, but it's just kind of early.
Yeah.
But 12 is the average age, 11, 12. And it can be irregular for those first two years. But after 2 years, the brain and the ovary should be communicating very effectively. And she should be able to track her periods and know, and they should have a steady pattern. It comes the end of the month, usually. It lasts 5 days. 2 days are heavy and the rest are light. Like there should be a predictable pattern after 2 years. If after 2 years she's still, it's not happening regularly, it's it comes and goes, the pain is still severe, then something else could be going on. Number one, it could be pregnancy. We can never rule that out.
Yes.
Two, it could be a hormonal thing like PCOS. It could be obesity. Some of the younger girls who are bigger, it can affect their ovaries. Their ovaries can get suppressed by the excess estrogen. The fat in our bodies, the excess fat in our bodies is converted to estrogen. And so if there's excess fat in the body, the ovaries are going to see this excess estrogen and be like, oh, we don't have to ovulate. We don't have to do the process. There's enough estrogen. And so that can make their periods irregular because the ovaries are not doing the regular monthly cycling. So if after 2 years from when they started their periods, it's still not regular, it's still not predictable, then that's something that they should also see a pediatrician or gynecologist for.
Okay, that's wonderful. And that sort of brings up maybe something else we could sort of end with, which is tracking the periods to start with, right? You talked about that. Could you sort of walk through the ways they could do that? I know, in the good old days, it was the calendar, and you could set the calendar, right?
Yeah.
But now everyone probably has a phone, who probably has
an app.
But tell us, how they can track it and why they should bother tracking it,
That's a great question. They can track it using their phones. And all they really need to do is track the first day. Like you don't need to say they don't need to track it every day of the period if it's a normal period. If by that time it's predictable, they know that day 2 is going to be heavy or something. They can just track the first day. So the first day to the next first day. And then if I look at your calendar and I can see each first day, then I know, oh, your periods are regular, they're every 26 days. Or your periods are every regular, they're every 28 days, they're every 30 days. If your periods are every 60 days, then that's abnormal. So that would be a reason to track it so that, your doctor or your parent can look at the calendar and say, when was your last period? It was 3 months ago. That's not normal. That's something that would alert your the mom or the dad that it should be evaluated. So there are all these cool apps, Flow app, even the Apple phone. The Apple phone has an app in there
section, right?
To track your period. You could have a calendar if you don't want such information in your phones. If you have people who have easy access to your phone like that, you can have a calendar, and you just need to write the first day. And you can also write how you feel during the period. Let's say day 2, you notice that you're more moody, you're more fatigued, you have more dizziness on day 2. And that will help in planning. That way, or more pain on day 2. That way, okay, my period is going to start Thursday. I'm going to start taking ibuprofen Tuesday.
Mm-hmm.
That way, you're blocking all the pain centers in your body
Before.
where the pain signals are coming. So the pain signals from your period will come, but all your pain centers are blocked with the ibuprofen. And so that will help your perception of the pain be less.
Yes.
And so tracking will also help you manage pain. That way your periods are not too painful. Tracking will help you know if your periods are regular or not, and you can plan. You know, you can plan vacation around your period. You can plan
Yes.
trips around your period, you know, school trips and things like that around your period. So it definitely helps to track it.
That's wonderful.
Yeah.
Well, again, thank you so very much. You know, this has been really helpful and very useful, and one that I'm sure lots of parents are going to come to, and one that I'll be referring parents to go watch, you know, for sure, because this is really great information. But why don't you share with us how people can get more from you, how they can hear more from you, how they can interact with you, and for those you know who in your area, if you share again where your practice is and how they can come consult with you.
Absolutely. Thank you so much, Dr. Obidi. I am on Facebook as Dadur Gynecology, Dardur Gynecology. I'm on Instagram as Dadur Gynecology. YouTube, I have a YouTube series like Dr. Obidi here. It's called
Very good
Uncommon
one.
Knowledge. Yeah, it's Uncommon Knowledge because there are lots of questions I get that I think should be common knowledge, but are not, you know, because people keep asking me. And so I created a show that's Uncommon Knowledge. So I share on there about periods, pap smears, breast cancer, anything women's health is on there. And my practice is in the Homewood, Flossmoor area. That is in the south suburbs of Chicago. So if you're in the south suburban area or in the city of Chicago, it's a smooth drive down I-94 to come in, I-94 West, East, I-94 East to come down and see me. And you can reach me on any platform to schedule an appointment. We're very responsive. We're watching those pages constantly, and so we'll be able to get in touch with you.
Wonderful. Thank you so very much again for coming
Thank
on. You
you.
guys go look for her. Her YouTube channel is fantastic. Great information. And it's just been such a pleasure. Thank you again. And for those of you in the Washington County area, again, this is Partners in Pediatrics and Family Health. If you're in the Washington County, Maryland area, we would love to be able to care for you. We're a family practice. We take care of both pediatric and adult patients. And just call the office at 301-791-7060. If you're watching this as a replay, type #replay. We'll stop by later on and just say hello, okay? All right, everyone. We'll see you again next week. And thank you again, Dr. Taiwo. It was wonderful having you here.
Thank you, Dr. Obidi. This was fun.
Yes, it was. Take care.